The big breakthrough in the field of machine learning and computer vision came around 2012 um, in this competition called the ImageNet Challenge, which was essentially a data set that people used to develop new algorithms, particularly deep learning algorithms that are now being applied to many domains, including many domains such as self-driving cars, uh, agriculture, finance, as well as, of course, medical imaging. Um, so the big breakthrough that deep learning brought was just a different way to think about the same problem. Essentially, in the past, when people used to think about how can we train a machine to identify an object, what they would do is so let's assume we want to find a chair in an image. What you would do is you would say, okay, we know, a chair has legs, which are, like say vertical. The chair has a seat, which is horizontal. It has a back, which is vertical. And they're structured together in a particular way. So let us design a system that can identify each of these components, put them together in the right way, and then we can say, okay, now we have found a chair. So that is how classical, like much more classical computer vision has progressed prior to this advance in 2012. While in 2012, what was introduced was this idea of convolutional neural networks. Interestingly, they had been around since the 1990s, but had not become popular for a long time for a variety of reasons. But the new way of thinking about the problem was instead of defining how we find a chair or how we break up a chair, we instead let the computer decide that based on a lot of data. So essentially, you give the computer, 1,000 images of here are images that contain chairs. Here's another 1,000 images that don't. You go figure out how you will build a representation of a chair and how you will learn to identify chairs based on just this high-level supervision. And turns out that if you have a whole lot of data as well as a whole lot of computing power, you're actually able to do this much more effectively, the process of identifying chairs. So the same type of advance can now be applied to a variety of fields, including images and pathology, where the goal is to identify cancer cells. And instead of specifying, hey, a cancer cell is larger or has this different shape as compared to the normal cells, we can simply provide the computer with examples of cancer as well as not cancer, and the computer is actually able to do a fantastic job at identifying these cells. And that is what we're building at PathAI. One of the other interesting aspects is that there is actually a lot of information contained in pathology images that a human may not have access to, because these images are huge and have on the order of 100,000 cells. So the next question we decided to ask, and which is a big focus of the company right now, is how can we get more out of what we're looking at? So essentially, instead of just trying to replicate what a human is already doing, can we actually try and predict how long a patient will survive using the same data? What it means is that we typically, a lot of our partners are pharmaceutical companies that are running clinical trials for new drugs. So essentially, they have a trial. In the trial, they're testing a new drug. So they will take this drug, they'll give it to, say, 1,000 patients. Out of the 1,000 patients, what turns out is, maybe 300 of them respond to the drug, they get better, and 700 don't. So what we're able to do is we're able to predict what patients will get better using their samples from before when the trial started. And as you can imagine, that can be extremely powerful for the patients, because they have a higher probability of being alive. It's great for the pharmaceutical companies because their drugs become more effective. And it's great for us because we get to work on really cool technology while saving lives at the same time.